In other news now, government has been accused of failing to place over 200 medical graduates, doctors. The South African Medical Association trade union says the unplaced graduates are now stranded and face a bleak future. This happens at a time when the country is already experiencing a shortage of doctors in hospitals. The Medical Practitioners Organisation says the department is failing the country's medical graduates. Now, our reporter Moloto Moloko has been following up on that story and joins us now with the very latest. Moloko, thanks for your time. You can almost set your clock to seeing the stories about medical graduates who are pulling out their hair, not knowing where they're supposed to start work next week, the first week of January. And last week I started seeing the tweets from certain graduates who, led by their frustration, have gone to social media to try and get answers. And I thought, oh, it's that time of year, because this is not the first time that that has happened, is it? Tell us where we stand right now. The shortage of doctors in the country, why is this a problem year in and year out?
Very disheartening, Marcel, is it not? In fact, according to the South African SAMATU, it's a doctors' union, it's a new union, they are saying that initially they had, a list of about 200 qualified medical practitioners who will be without a job come the 1st of January. But that list has been growing. Now it's standing at around 428 or so. And these are people who have already completed their internships, they have completed their community services. In other words, they must be deployed there as medical practitioners. They are qualified. But it seems as if, as you say, almost every year we go through this cycle. And this union is also saying that while you have that category of people who have completed their ComServe, who are ready to be employed, you now have those who must also do internships. And there's a difficulty there. And even those who completed their internships, they say there's about 30 of them, they ought to go into the community services. Again, they say 30 of them in the Western Cape up to now. The provincial government apparently saying it can only employ them as ComServes, and in the beginning of the financial year, which should be in April. And they are saying they continue to receive such reports even from other provinces. So at this point in time, it seems to be dire. But let's listen to Dr. Cedric Setlangu, who is the Secretary General of SAMATU.
What's actually happening currently is that the post-community service doctors, those who have just completed community service, are now going into the world of work as independent practitioners. And these are people who want to serve. These are people who want to work for the communities that they come from. They want to work in the clinics, the far-flung clinics. They want to work in the level 1 hospitals because they went to medical school for that, by and large. Now, what the department is then saying is that there's no the budgetary constraints, and therefore they don't have enough money in the fiscus to be able to employ these doctors. Now, if you understand that health in our country and in many other countries, in fact, world over, is a basic human right. We are of the view, as the South African Medical Association trade union, that it is a responsibility for government to ensure that there's proper resource allocation so that these interns can be placed in the various facilities to serve their people. It's not good enough to say, well, they've just completed community service, therefore they're free. They can go to private as they wish, because that's not what these guys, these doctors went to school for. They want to serve their people, and they want to serve those who are not well-to-do, those who don't have much, and that's the compassion that doctors have. So we are very concerned as the trade union that we can't have a government that wants to act in this kind of manner.
I mean, this is a story that really boggles the mind year in and year out. And he speaks specifically about students wanting to service communities that we know from the stories that we do week in and week out, are the communities that need those graduates the most. Can we even quantify what kind of impact this lack of competence or administration could actually have on the health sector going forward?
Well, Marcel, according to the World Health Organization, they estimate that there would be a shortfall of 10 million healthcare workers worldwide by 2030. That is in 7 years from now, particularly in the low and middle income countries. We are surely not a first world country. We are not an exception. And there's a general agreement both by the government and, of course, the other stakeholders that the doctor-to-patient ratio in our country isn't impressive. So there's no question there is a dire shortage of medical doctors in our country. So what is happening here is that these medical doctors who have already done the ComServe, they now have an option of going into the private sector. They also have an option of going overseas because their skills are needed there.
Yeah.
Those countries even pay far much better. Who is going to suffer? It is the people in South Africa who do not have an option of going into the private health care sector. But then another thing is that government does invest. Anybody we know who goes to university in this country, government subsidizes those people. So government would have spent so much money. Training a doctor takes about 5, 6, 7 years, whatever. So it means government would have spent money just to let people go out of the system, whereas they are highly needed.
Yeah, and we learned during COVID that there is an even more bigger demand now for South African healthcare workers overseas because they have, like you said, the WHO is already speaking about there being a shortage in other parts of the world. So there's almost nothing keeping them there. Yeah. Now, you have reached out to the National Health Department. What was their response?
So the National Department that is headed by Minister Joe Phaahla, it's at the national level. The conundrum here is that it does not employ the medical doctors. The medical doctors are actually employed by those who are qualified. They are employed by provinces. So what the department does is that it would get a grant, and I'm told, I think this year it's about R1 billion or so. So it would, over 3 years, it would hire the interns and then take them to provinces. But when it comes to those who are qualified, who have already completed their internship and the ComServe, for them to be employed, it is the responsibility of provinces. So what they are saying, therefore, is that they have reached out to SAMATU to say, give us a list. Up to now, the department says it's got a list of about 200 people, but it says that list doesn't even have the ID numbers of people who are said to be unemployed. Now, it would require that list, send it to the provinces, and it's up to the provinces to advertise those vacancies. Another major dilemma is that while you might have vacancies, the issue is that some of those vacancies are not funded. But let's listen to Victor Kanyile, who is from the National Department of Health.
The National Department of Health took a step to engage SAMATU to say, if there are such unemployed doctors, as they were calling them, we would really appreciate to get their data. And after our engagement with them, we did get a data set of at least 200 people. However, the data was incomplete in a sense that there were just names without surnames. In other instances, you would find that there's name and surname, which do not, all of them, did not have an identity number, which is a unique identifier of an individual. That helps us to can search on our system of employment, which would confirm whether that person is not yet employed. Secondly, to check with the Health Professions Council of South Africa that that particular person is indeed eligible for medical practice, that they can be employed. Over and above that, as the National Department of Health, we would then refer those people to provinces that are responsible to employ for services in the public health sector. So our role was to take the data as correct as we wanted it and circulate it to provinces to say, these are doctors that are available. And I mean, it has been said that they are available from the 1st of January 2023.
That was a reporter, well, not that person speaking, but we've just received that update from our eNCA reporter, Moloto Moloko.